Moving to the next section, cellular injury. Probably the easiest way to understand this section is to put it in the context of what we just covered. So you'll recall that I said that a cell can be stressed, and that stress can lead to growth adaptations. In particular, if there's an increase in stress, we would expect to see hyperplasia and hypertrophy. If there was a decrease in stress, we would expect to see atrophy. And if there is a change in stress, we would expect to see metaplasia. Now, it is possible that the stress could be so severe that it exceeds the cell's ability to adapt. Now, why is that important? Because if the stress exceeds the cell's ability to adapt, then rather than undergo a growth alteration or a growth adaptation, the cell will actually become injured. And that's really what this section is all about, cell injury. Now, we could ask a simple question here. What determines whether the cells of an organ are going to adapt or they're going to become injured? Well, actually, there's three major factors. The first is the type of stress. So, for example, if a cell were to, or if an organ were to become inflamed, it's much more likely that the inflammation would result in a growth adaptation than perhaps injury. The severity of the stress is also important. Just to give you a very simple example, if you slowly cut the blood supply to the kidney will atrophy due to the decrease in nutrients. So maybe a classic example of that would be atherosclerosis of the renal artery or fibromuscular dysplasia of the renal artery. Either of these two pathologic processes would slowly cut the blood supply to the kidney, and as a result, the kidney would shrink in size because it would undergo atrophy. So that's slowly developing ischemia, or a slow cutting off of the blood supply. However, if there was a thrombus in the let's say, for example, left heart, and that thrombus was to break off and embolize and then lodge into the renal artery, that could block the blood supply to such an extent that a cutoff of the blood supply to, let's say, completely would actually result in infarction or death of the kidney parenchyma. And so here we see that sort of the same theme in the sense that we cut the blood supply in the renal artery, but a slow, progressive cutting blood supply of the renal artery would result in atrophy of the kidney, whereas a rapid, complete cutting off of the blood supply of the renal artery would result in infarction and injury of the cells. So that would be an example of the severity determining what happens in response to a stress. And the third factor that determines what happens in response to a stress is the type of cell that is affected. Now, what do we mean by that? Well, one of the high-yield principles to be familiar with, and examiners like to go after this, is the fact that neurons are very susceptible to hypoxia. In fact, the neuron has the ability to withstand hypoxia for only 3 to 5 minutes, whereas skeletal muscle, which is another type of cell, actually can withstand hypoxia for very long periods of time. And so the type of cell affected will also determine how the organ or the cell adapts to a particular stress. Anyway, in this particular section, we're dealing with injury. And so if I just very quickly read to you what we have here on our text, we say that injury occurs when the stress exceeds the cell's ability to adapt, as I've already explained. And the likelihood of injury is going to be based on the type of stress, the severity, and the type of cell that is affected. All right. So moving on, while we're on this topic of cellular injury, we should remind ourselves that as we go through the remainder of this text, there are going to be many common causes of injury. For example, inflammation is a common cause of injury. You can take any example. If a patient gets an infection, a pneumonia, that's going to injure the lung. At the same time, there are some chronic inflammatory states like autoimmune diseases that would also result in injury. Nutritional excess or deficiency can result in injury. We're all familiar with that. In fact, much of the disease that we see in the Western world is actually due to nutritional excess. And much of the disease that we see in areas where poverty is prevalent is really due to nutritional deficiency. So these are common causes of injury as well. Hypoxia, very classic cause of injury. All of the myocardial infarctions and stroke, ischemic stroke to the brain are all examples of hypoxia. And we're actually going to spend some time discussing hypoxia in more detail in a few minutes. Trauma, common cause of injury. For example, a gunshot wound to tissue will injure the cells. And genetic mutations. When there are mutations and proteins are not formed or not formed properly, that can also result in cellular injury. Now, all of these themes are going to be repeated as we go through the text. However, what I want to really focus on for the next few minutes is hypoxia. Hypoxia is a nice model for studying cellular injury, and so we're going to focus on that over the next few minutes. So before we can begin our discussion of hypoxia, we really need to understand the term hypoxia. So let's do it this way. Hypo means low, and oxia refers to oxygen. And so hypoxia is low oxygen, and in particular, it's low oxygen delivery to tissues. Now recall that tissues are essentially dependent on oxygen. And the reason they're dependent on oxygen is because oxygen is the final electron acceptor in the electron transport chain. That accepting of electrons by oxygen allows for the generation of ATP, and so low oxygen is going to impair oxidative phosphorylation, leading to low ATP. And low ATP, which is an essential energy source, will lead to injury. So why don't we just summarize it by saying low oxygen, low ATP, cellular injury. And that's why hypoxia causes cellular injury. Okay, so the next discussion would be, what are the causes of hypoxia? And actually there are broadly speaking, there are three major causes of hypoxia. The first is ischemia, the second is hypoxemia, and the third is a decreased O2 carrying capacity of the blood. We'll actually elaborate on each of these in the next few slides. So let's start with ischemia. Ischemia is decreased blood flow through an organ. Probably the easiest way to think about this is, I'll draw you an image here. This is the artery, and it is feeding any organ. It doesn't matter for this particular discussion. And this is the vein, which is draining that organ. Now, ischemia refers to decreased blood flow through that organ. So this is the way that blood would be flowing through the organ, obviously. And ischemia can occur in two ways. The first way, well, actually there's three ways, but two very common ways. The first way would be for there to be a block in the arterial flow into the organ. So if there's a block in the arterial flow, for example, atherosclerosis, that would decrease the blood flow going through the organ, which would then result in ischemia within this organ. I think we're all very familiar with that. It's a common principle in pathology. It's going to result in many disease processes. For example, when there's atherosclerosis of the coronary artery, that results in angina or episodic chest pain. But we don't need to worry about those details yet. We'll get those later. The idea here is that decreased atherosclerosis of the artery would result in decreased blood flow through that organ. I think we all have that down. The next, the other way by which we could get ischemia, and perhaps this is something that we don't think about as much but shows up often on examinations, is that we could decrease the flow through the vein. And if we block this vein, for example, then we would block the flow of blood across this bed, and by blocking the flow of fresh blood across that bed, we would decrease the amount of oxygen within this organ. And that would then result in ischemia of the organ. Now, there are many examples in pathology of this, but there's one very high yield, shows up on examinations all the time, and that is a syndrome called Budd-Chiari syndrome. Budd-Chiari syndrome we'll actually discuss in more detail when we cover liver, but in Budd-Chiari syndrome, there's a thrombosis of the hepatic vein, and by blocking the hepatic vein, blood no longer can flow through the liver, and that results in infarction within the liver parenchyma. It can actually cause death. That's Budd-Chiari syndrome, very high yield. Another high yield derivative of Budd-Chiari syndrome, as long as we're on that topic, I can ask you the question, what's the most common cause of Budd-Chiari syndrome? So the answer in your mind should be that the most common cause of Budd-Chiari syndrome is polycythemia vera. Recall that polycythemia vera is actually a disorder in which patients have a high red blood cell count due to overproduction of red blood cells, and that makes the blood thick and viscous. And the increased thickness and viscosity of the blood leads to a complication of thrombosis or clotting. And one place in which thrombosis can occur is within the hepatic vein, which would then lead to Budd-Chiari syndrome. Just as long as we're on the topic, another classic example of Budd-Chiari syndrome or cause of Budd-Chiari syndrome would be a patient with lupus who has something called lupus anticoagulant, which creates a hypercoagulable state in that patient. Anyway, I don't want to press too hard on the specific examples, but really at this point I'm trying to lay down a basic principle in your mind. We'll really have a lot of time to talk about the common and classic examples of Budd-Chiari when we do the liver. So this is one way by which ischemia can occur, and of course ischemia would be a cause of hypoxia, which is the discussion that we're having. A third way by which ischemia can occur is called shock. Shock refers to a generalized decreased perfusion of the vital organs, and it can occur, for example, if the heart's not functioning properly, we get a cardiogenic shock. If there's not good blood volume in the vascular space, because let's say there's a gunshot wound, we'll have a hypovolemic shock. There's also a neurogenic shock, an anaphylactic shock, a septic shock. In each of these cases, the central theme is that there's a decreased ability to perfuse the vital organs. And of course, if blood is not flowing to the vital organs, that would be an example of ischemia, and that would result in hypoxia of the cells or decreased oxygen going to the cells. The second cause of hypoxia is hypoxemia. Now, here, we've got that same hypo and then oxygen, low oxygen, but emia means in the blood. And so hypoxemia refers to a low pressure of oxygen or low partial pressure of oxygen within the blood. Very specifically, it would be defined as a P small aO2 less than 60 millimeters of mercury, and that would translate usually to roughly an SaO2 of less than 90%. This sometimes confuses students, the concept of hypoxemia, and so I think that maybe we should take a step back and review a little physiology here in order to understand this concept a little better. So why don't we do it in the following way? Let's remember that there's a certain concentration of oxygen present within the atmosphere, which is called the FiO2. This is really the fractional percentage of oxygen within the atmosphere. And the goal of the lungs is to bring that FiO2 into the alveolar air sacs and to create something called the P big aO2. So the P big aO2 is a partial pressure of oxygen within the alveolar airspace. Now that PaO2 squeezes oxygen. That pressure is used to squeeze oxygen across the interstitium and into the capillaries, which then creates a P small aO2, which is the partial pressure of oxygen within the arterioles. And then that PaO2, that P small aO2, its goal is to squeeze oxygen across the red blood cell membrane to load oxygen onto hemoglobin, creating an SaO2. So this is sort of the sequence of how oxygen is squeezed eventually into hemoglobin. So the FiO2 results in a PaO2, big aO2, which is the pressure of oxygen within the alveolar airspace. That squeezes blood across the barrier that squeezes oxygen across the barrier into the blood, which creates a P small aO2 in the arterioles. And then that squeezes oxygen across the cell membrane, the red blood cell membrane, into the red blood cells, which then creates an SaO2. Now, hypoxemia, again, as I've already told you, refers to a low PaO2. So really, this number would be low. But you can see that what actually feeds the P small aO2 is the FiO2 and the P big aO2. So any change prior to this, in this sequence, in the early phases of this sequence, would also decrease the PaO2. So let's just take some common examples. If a patient is at high altitude, all right, high altitude, Then, when they're at high altitude,